Jessica Rosales, your student nurse for today. So, what is your name, ma'am? So, ma'am Precious, ang gagawin ko ngayon ay i-assess ko ang iyong head, eyes, nose, ears, mouth, and neck. Okay lang ba sa'yo? Yes. So now I am going to close the curtain for privacy. Then perform hand hygiene. And wear gloves if necessary. So ma'am, I'm gonna proceed assessing your head and scalp. So first, inspect the scalp with the size, shape, and contour. Then now I'm going to observe the head of the patient. So note for any lines, dandruff, or lesions. Now I'm going to palpate the head by running the palm of my fingers. So, do you feel any pain, ma'am? May masakit ba? Wala. So, now, I'm going to assess the face of the patient. So, ma'am. So, the palpebrae fissure of the patient seems to be symmetrical. Could you smile for me, ma'am? So, the nasolabial fold of the patient seems to be symmetrical, both right and left sides. So, now, I'm going to assess. Could you close your eyes, ma'am? May nararamdaman ka, ma'am?
Yes.
Yes. Okay. Pwede mo sabihin kung saan? So, okay now. Okay? So now, pwede ba bang ilabas ang iyong dila, ma'am? Tapos sabihin mo kung anong lasa nito? Anong lasa, ma'am? Maasim. So now, I'm going to ask, could you close your eyes, ma'am? Okay, open. Could you smile? Okay. Could you raise your eyebrows? Okay. Could you pop? Okay. Okay, you can go back. Okay. So now I'm going to assess the eyebrows of the patient. So first, inspect for the symmetry, and it seems to be symmetrical and in line with each other. Could I touch your eyebrows, ma'am? Okay. So it seems to be evenly distributed, and even the lashes is well distributed. So now I'm going to inspect the eyes of the patient. So the eyes of the patient seems to be symmetrical and in line with each other. So now I'm gonna assess the eyelids of the patients and lacrimal apparatus. First, inspect the eyelids for position and symmetry. Then I am gonna palpate the eyelids for lacrimal glands. So first, I'm gonna slide my pads of fingers to the upper orbital rim of the patient. May nararamdaman kang sakit, ma'am? Wala. So now I'm going to palpate the nasolacrimal duct of the patient to the lower orbital of the patient. Do you feel any pain, ma'am? May nararamdaman kang sakit?
Wala.
Wala. Now, I'm gonna assess the bulbar conjunctiva of the patient. So, ma'am, can you look up? Can you look down? So now, I'm gonna place a cotton wisp. Then gently push downward while still holding the lashes. So the patient's lid has no swelling, infections, or any foreign bodies. So now I'm gonna examine the pupil of the patient. So first, inspect the pupil for size, shape, and light reaction to observe the direct response of constriction. And now for the papillary accommodation of the patient. So ma'am, can you gaze to this object? So, the papillary size of the patient changed when I move forward and backward to this object. So now I'm going to assess the visual acuity of the patient. So ma'am, can you cover your one eye? Then read this one.
E, F, D, D, O, Z, L, E, E, D, E, E, C, F, D, E, D, F, C, D, P, F, E, L, O, P, D, 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 E, F, O, D, P, C, D, L, E, F, O, D, P, C, D, F, O, P, L, D, C, E, O, V, E, Z, O, N, C, F, D, D.
Okay ma'am, to the other one. Okay.
P, E, Z, O, L, C, F, D, D, F, D, E, F, D, C, E, O, D, E, F, O, D, P, C, D, E, D, F, C, D, E,
Now I'm going to assess the peripheral vision of the patient. So ma'am, can you cover your one eye? Okay. Then stare directly to my eyes. Then, nakikita mo ba ito ma'am?
yes,
Ito ma'am?
yes,
Ito?
yes,
Okay. The other one ma'am? Then stare to my eyes. Then nakikita mo ba ito ma'am?
yes, yes, yes,
Okay. So now, I'm gonna move this object. I-move ko tong object. Tapos, yung mata mo lang ang pwedeng gumalaw at hindi yung neck. Okay?
okay,
Okay? Nakikita mo ito ma'am? Okay. Okay.
that's laki na
Okay. So now, I'm going to assess the ear of the patient. So first, inspect for the size, position, appearance, and color. Now, I'm going to palpate the auricles and mastoid of the patient. May masakit po ba, ma'am? May masakit po ba, ma'am? Wala. So now, I'm going to inspect the ear canal of the patient. So, the ear canal of the patient is same color to the ear, has no foreign bodies, and have a cerumen. But having a cerumen is normal. So now, I'm going to assess the nose of the patient. So first, inspect for the symmetry and position. And it seems to be symmetrical and in the middling. So now, I'm going to occlude the one nostril one at a time. Mahirap bang huminga, ma'am? No. So isa naman. Mahirap ba huminga, ma'am? No. Now, I'm going to palpate the external nares of the patient. Masakit ba, ma'am? No. Now, I'm going to inspect the nasal mucosa of the patient. So, the nasal mucosa of the patient has no swelling and change in color. So now, I'm going to palpate the both cheeks and under the eyebrows. May masakit ba, ma'am? Wala. So, ma'am, can you close your eyes? Naaamoy mo ba ito, ma'am?
yes,
Pwede mo bang sabihin kung ano to?
Alcohol.
Alcohol. Okay, so you can open your eyes. So now, I'm going to assess the mouth and lips of the patient. So first, inspect for the symmetry, surface abnormalities, color and edema. And now, I'm going to assess the temporomandibular of the patient. So first, palpate with open mouth. May masakit ba, ma'am? Wala. So now, I'm going to assess the gums of the patient. So, the gums of the patient has no swelling and no bleeding. So now, I'm going to assess the teeth of the patient. So first, inspect for the color and number of the teeth. So now, I'm going to assess the tongue of the patient. So first, inspect for the color or any lesions. Pag kinabas yung tongue, ma'am, pwede mo bang i-move? Okay, so now, palpate the tongue for the texture. Pwede po bang hawakan, ma'am, yung dila mo? Okay? Okay. So now, I'm going to assess the uvula of the patient. So first, inspect for the position and color. Can you open your mouth, ma'am? Open pa. So, pwede mo bang sabihin na Okay? So now, the uvula of the patient move upward and downward, which means it is normal. So now, I'm going to assess the neck of the patient. So first, inspect and palpate in front of and behind the ears. So now, I'm going to inspect and palpate the carotid arteries, left and right. Palpate only one at a time. Then use the bell of the stethoscope to auscultate the arteries. So now, palpate the trachea, thyroid gland, and supraclavicular area. So now, I'm going to inspect the ability of the patient to move the neck. So first, ma'am, can you move your chin to the chest? Do you feel any pain, ma'am? Wala? So now, I want you to move your head to the shoulder. Do you feel any pain? May nararamdamang sakit? Sa kabila? May sakit ba? Okay, now. Now, I want you to move your head to the back. May sakit ba, ma'am? So, okay, that's all. And thank you for your cooperation, ma'am. Then, I'm going to perform hand hygiene.